So it doesn't matter, no, whatever vaccines you got during your primary vaccines, then you are rest assured that you were actually protected. Number two, whether you had homologous or heterologous vaccination, they are both comparable. Although, of course, no, there's a little slight difference wherein the protection rate given by the heterologous seems to be a little bit better. But again, no, the difference isn't really that great. And therefore, if you had, like let us say you had Astra for your boosters, then rest assured you were given enough protection, particularly for severe infections. Or Sinovac, no? So, or if you have a mixed schedule, okay? Number three, I think the most important, I would like to emphasize that the most important information I got from this discussion today is the safety profile. No, diyan ho tayo tinitira ng mga anti-vaxxers. No, the safety profile, and it has been shown. No, you look at the data, the safety profile is really quite good. And the benefits, from the vaccines that we have far outweighs the risk. So yun ho ang pinaka-importante, that all the time, as a clinician, this is the first dictum that we always have to take, and that the benefit must outweigh the risk. And for this vaccination, definitely the benefit far outweighs the risk that we can get from COVID-19. And as you can see, in the data, 12.5 billion doses already administered, and 19.8 million estimated lives saved. No? So I think I need to emphasize that. And lastly, all the data has actually shown consistent effectiveness of the vaccine, including the Omicron variant. So this actually suggests that there probably is really no need not to wait for the development of variant-specific vaccines. Although sabi nga ni Dr. Jean Solante, having the variant-specific vaccines, like let us say for specific, like for Omicron specifically, then syempre mas mataas yung magiging expected protection, against that particular variant. Pero pag dumating na naman ng another variant, then what I am just saying here is that we need not worry about, getting variant-specific vaccines, because the current vaccines that we have right now is still quite effective. So with that, to further strengthen our discussion, particularly in this fight against the pandemic, of course, we have a representative from the Department of Health, and we know how tirelessly the DOH have really given, how tirelessly their efforts are as far as their desire to see the majority of the Filipinos to get boosted, So it will actually be good to hear from the department's plans in the pipeline and their call to action, so that more people, particularly the ones in the medical field, as well as the private sector, including media and local governments, how we can get everyone involved. So let's hear the thoughts from the Department of Health, straight from Dr. Imran Rodriguez.
So, to all our medical professionals from the Philippine College of Physicians, to all our distinguished speakers in our roundtable discussion earlier, and all the representatives from the different organizations, a pleasant afternoon to everyone. I'm Dr. Imran Rodriguez from the Department of Health. So we've heard earlier po, no, how important it is to understand how our vaccines work, particularly why it is important to have our booster doses, regardless whether it's heterologous or homologous, no, to help us protect our communities. Also, we heard earlier how we discussed the risks and benefits of getting vaccinated. We've had additional information on the possible adverse effects as well. And I think that the biggest challenge that we are going to face in the next coming months is how we educate the Filipino people, how we get the message across that getting vaccinated is safe and that it protects them amidst all their misconceptions. So I think that at the heart of these discussions, we can all agree that vaccinating our communities is really one of the most crucial public health intervention that any country could have put an end to this pandemic. So now in this discussion, we at the Department of Health would like to share the efforts that we are currently conducting in the country and how we can all align and to increase our vaccine coverage and help us fight this pandemic. So to start, let me just give a brief background on our COVID-19 situation. So as of September 7, 2022, the Philippines has reported a total of 3.8 million cases, of which 97.82% have recovered. Recorded deaths have remained relatively low, yielding 1.6% CFR, or known as the case fatality rate. And to date, we have surpassed 4 surges of COVID cases in total. The first one being the surge caused by the original strain on August 2020. So our highest recorded 7-day moving average was during the Omicron surge last January 2022 with around 35,000 cases per day. So as we can see in the recent weeks, we have seen a decline in the number of cases nationally. So with the current 7-day moving average of 2,372 cases per day being 1% lower than what was reported the week prior. Additionally, there are currently 88 provinces, highly urbanized cities, and independent component cities, and 180 other component cities and municipalities have been de-escalated to alert level 1, while 33 other provinces, HUCs, and ICCs remain under alert level 2. So now, in order to provide greater protection to our communities and further drive down our number of cases, our vaccination efforts in the country continues. So as of September 5, we have already fully vaccinated 72.6 million Filipinos. So that is equivalent to 93.01% of our target population. Furthermore, around 18.2 million individuals had already received their booster doses. So this amounts to 23.4% of our target population. So these accomplishments would not be possible without the help of our different sectors in healthcare. And we would like to also extend our gratitude to everyone, to all our healthcare professionals, for your efforts in helping protect our communities. So our efforts in fortifying our wall of immunity should continue, especially if we envision to provide a safer and healthier living conditions to our communities. And in order to do this, we have to give immense importance in protecting our vulnerable population, such as the senior citizens, and boosting the waning immunity. So as such, the Pinas Lakas campaign was launched last July 26, 2022 by the Department of Health. So the President back then instructed the DOH and all implementing units, both public and private, to operationalize and implement the said COVID-19 vaccination strategies. So with the specific goal of achieving 50% primary series in the A2 population, and also 50% coverage in the first booster doses for general eligible population. So these targets, as seen in the screen, were presented to the Office of the President last July 6, and the Department of Health computed a total of 1.07 million remaining target for the primary series among A2 population. While for the booster doses, we have a remaining target of 23.8 million among the general population. So for this campaign, we have been targeting to vaccinate around 17,000 senior citizens for primary series, while 397,000 for the general population for boosters per day. So where are we currently faring? So this slide shows the weekly trend for A2 population for the first 100 days accomplishment. So as of September 5, a total of 26,290. So that is equivalent to 2.48% senior citizens who have already completed their primary series. So we still have 1.047 million individuals to complete the last dose of primary series in the A2 population to reach our target. A2 vaccination proved to be very challenging as efforts have been stretched in looking for the unvaccinated seniors first and giving them their first dose of their primary series before having them eligible for their second dose of primary series to achieve our 90%. So while we had increasing jab rates as we progress in the weeks 2 and 3 of the campaign, our accomplishment started to decline during the fourth and fifth week. So while we have relatively regained the increase in our week 6 accomplishment, we are hoping that such will be the momentum to further increase our coverage. So we would also want to commend regions 2, CAR, and NCR for reaching the 90% A2 coverage prior to the start of the Pinas Lakas campaign, and for continuously looking for our senior citizens to get vaccinated and further increase their coverage. So this can also be seen on the stack bar chart on your right side. So the dotted line shows our Pinas Lakas target, and the mentioned regions earlier have already reached our Pinas Lakas targets. So for our booster accomplishments, we can see that our trend for weekly accomplishments also shows an increasing trend for the first 3 weeks of our campaign. However, as we entered our 4th and 5th week, we noticed a decrease in coverage. And as of the week 6, our trend relatively increased. And we are hoping that this trend also will continue in the next weeks as we end our campaign. So the stack bar graph on the left shows that our region coverage for booster doses are still far from our targets, with NCR as the only region almost reaching the targeted 50%. So given that our daily jabs among the priority group A2 and the eligible population for booster have not been met since the start of the campaign, this resulted in a higher weekly target for the remaining weeks of the first 100 days. In order to regain our momentum of the COVID-19 vaccination program, a week-long vaccination drive is needed, which will simultaneously be conducted nationwide to catch up with the increasing targets per week and to ensure the judicious use of available COVID-19 vaccines in the country. And so as such, we will be conducting the Bakunahang Bayan or the Pinas Lakas Special Vaccination Days from September 26 to September 30. So this vaccination drive aims to facilitate the rapid mobilization of vaccination services among all eligible populations. So prioritizing our senior citizen for completion of their primary series and all our eligible population for their first booster vaccination. So now that we have around 2 weeks to prepare for our Bakunahang Bayan, and also that's equivalent to around 30 days na lang po, no, remaining for the end of the Pinas Lakas campaign. So in line with this, we would also want to request our experts from the different medical societies and professional organizations to join our vaccination drive. So your mere presence as COVID-19 vaccine ambassadors can really help us convince more people to get vaccinated. We are also requesting for you to help us in advocating vaccination among the eligible population, especially among your respective members. So sana po lahat po sila ay fully vaccinated din and boosted din po. So in line with the current strategies of the COVID-19 vaccination program, we would like to gather support in terms of conducting vaccination in our clinics, the workspaces, and other strategic locations. So issuance of position papers and release statements regarding the safety and effectiveness of COVID-19 would also be crucial, especially if coming from our medical societies and professional organizations. So if it would be possible to have also an issuance of memorandum of support to the presidential directives on the COVID-19 vaccination for the first 100 days. And also, as experts in your respective fields, we seek your support in communicating the safety and effectiveness of our COVID-19 vaccines under stability studies. So, and debunk the misconception on shelf life extension. So we have been having reports that some individuals and healthcare workers are still hesitant to get vaccinated with vaccines that had their shelf lives extended. So even if these vaccines underwent a stringent study, so we need your help to address and give important information to correct these misconceptions, and that would be very crucial in increasing our coverage in the country. So more recently, the department also released an advisory for our lay people to explain the extension of shelf life through stability studies. So we also released an advisory to healthcare workers indicating the updated shelf life extension of certain vaccines. So the labels on the vaccines cannot be hampered, hence the need to explain to our healthcare workers, the general population, that vaccines have extended shelf life even if the label has a due expiry date. So more importantly, we look into you to help us educate the people regarding the need for booster doses, especially those who are already complacent having their having completed their primary series. So this have been a very big challenge for us in order to keep our coverages high. So we've seen your presentations earlier regarding the VAC up, and all these efforts are also very much appreciated in increasing our booster coverages. So we've learned earlier in our discussions that the importance of our boosters, that although it doesn't really protect us fully from getting infected, it gives us protection from getting the severe disease and death. So although that we are having the national vaccination days within the Pinas Lakas campaign, we would like to highlight that our vaccination efforts will still continue beyond the vaccination days. So how else can we collaborate? So our Pinas Lakas campaign educational and motivational materials are already available in the link shown in the screen. So we can send this to the respective organizations for your easy access. So also, we can also be proactive in tapping our local chapters, reach our local governments, and conduct or participate in events such as town halls or become resource speakers to educate more communities. We can also help generate demand and support from all healthcare workers down to the local level through activities that promote vaccination. So also, as mentioned earlier in the PCP, they will be having webinars. The DOH also will conduct a series of webinars. So on September 15 via Zoom, and all our local chapters may tune in for the most updated policies and guidelines. And finally, we can also try to incentivize going to site by offering possibly free consultations in VAX areas for both primary and specialty care. So to end, once again, our deepest gratitude for all of your efforts to support the national vaccination program of the department against COVID-19. So ang lahat po ng ating mga efforts at magiging suporta sa mga susunod na linggo at buwan ay mas makapagbibigay po ng karagdagang proteksyon para sa ating mga komunidad. So muli, maraming salamat po sa inyong lahat at magandang araw po. Thank you.
Dr. Imran, and we will now proceed with our local question and answers, right here and right now with our dear speakers, Dr. Ana Ong Lim, Dr. Dean Solante, and the two will actually be joined in by Dr. Diana Payawal, the PCP president, and while waiting for the setting up of the table and the chairs, let me just again remind everyone for the benefit also of those who are here with us right now. Madalas ang lagi nating naririnig hindi naman daw nakaka-prevent ng infection, nahahawa pa rin ang mga tao from COVID-19. No, if that is in spite of the COVID-19 vaccination that they got, I just want to emphasize that the key outcome of our vaccination campaign is really not just prevention of reinfection. No, it is the prevention of serious illness so that we can also prevent death of Filipinos. So with that, the floor is now open for any questions that our media friends here would like to ask. Yes?
Yes, good afternoon po. Alright, good afternoon po, Ed Mendoza po, Manila Times. And po, nasabi nga po kanina, preliminary pa nga lang po yung data regarding the fourth dose. Sinabi nga po niyo, Doc Ana, na medyo encouraging yung data about the fourth dose. And yun nga, yung the expert said nga na medyo na there is increased protection with the fourth dose. So, with that being said, do you think po ba, pwede na po ba ang fourth dose sa general population? Kasi right now, ang fourth dose is for 18 to 49 na immunocompromised and with comorbidities and 50 above. So, do you think po ba itong data na ito would be a strong point to convince the government na pwede na ba nating ibigay ang fourth dose sa general population?
Yeah, ako muna, tapos maybe I'll pass it on to the rest of the panel for their inputs. So going to the database na tinignan natin kanina, this is from the IVAC data, medyo limited talaga yung information. And you can understand that the way those studies were designed was actually utilizing at-risk populations. So para sabihin natin, and therefore we can conclude na the rest of the population will benefit. Hindi gagaling sa dataset na yun. Mahirap mag-conclude from that database. Siguro yung additional information na shinare ni Dr. Suwat coming from their Thailand study, kung ma-replicate yun or masusupport siya ng other studies, that can be a basis for saying na katulad nung third dose which we are encouraging for everybody from 12 and up, eventually darating tayo sa fourth dose. Siguro personally, yung perspective nito, I think the fact na medyo huli tayo nagsimula ang bakuna, we can turn that to our advantage. Nakikita natin yung developments in other countries, nakikita natin na may pakinabang ang fourth dose for certain populations. Pero nandito na yun, yung bivalent vaccines na ginagamit sa ibang bansa. So who knows that maybe when the time comes na talagang karamihan sa ating mga population ay nag-wane na ng gusto yung immunity, ay mas maging widely available na yung bivalent at yun na ang po natin is the fourth dose. So ako, I'm hoping na sumakto na naman yung timing natin para mapakinabangan natin yung advancement na yun.
So, any joiner to the Anna? Jean?
Yeah, I totally agree with Anna. No? The data is telling us that when you add a second booster, that will also be, you have some protection, but not against getting the infection. It's still about getting the severe infection. So translating it to which population will really benefit it, then pwede na mag-focus pa rin sa vulnerable population. And again, emphasize the importance of a first booster among the general population instead of focusing on the second booster for this general population.
Okay, so are there any other questions? Yan, tinuturo ka na, Dayan.
Okay, thank you. I think the data is quite impressive for sa sinabi ng ating dalawang eksperto sa infectious dito. So I think we should focus on the A2, 2.4% lang ang nagbakunahan sa A2. And the rest, of course, will follow if you are able to achieve a higher vaccination for the A2 population. So we have to take cost effectiveness as an issue also here. So I think the vulnerable population is where the focus of booster is.
Thank you. So I can see one raising hand, the one in blue.
Hello, sorry. Hi, I'm Bunso Sampol from Rappler. Okay, natanong na kasi yung question kanina about the fourth dose. Pero like what you said, na parang as of now, wala pa sa equation yung giving the second dose. And we should focus on ramping up the first coverage for the general population. Pero there are people talaga kasi na ayaw pa rin magpabakuna. And ano kaya yung ways natin or what do you recommend for the government, specifically for the Department of Health, to boost our booster uptake, the first dose?
Yeah, okay, Diana.
Yes, thank you for that question. I think as the Philippine College of Physicians president, we are already advocating a lot of programs geared towards this. And I think this is the 9 tools now that we have, that's part of the program with this webinar. So I think information dissemination, ng safety ng bakuna, I think most of the people are hesitant because of the adverse effects. Now, you have shown, I mean, the previous speakers have shown the adverse effects are not as much now. So, of course, we will not contend with the fact that there are adverse effects. So, I think the bottom line here is information dissemination and close monitoring of our patients underwent vaccinations. So, I think most of us physicians do that. I think we opened our lines for patients who are vaccinated, or for our own private patients who are undergoing vaccination and who have this fear. So I think it's one way we can help as a private organization. For the government, I think they have done a lot. I mean, you can see we are all out right now, and there is a move to be a little lax on face masks. So I think this is something that we have to commend the Department of Health for doing this project.
Box, can I just add to the question, the answer of Dr. Payawan? I agree, no, na information is critical for people to understand that it's important to be boosted. Siguro ang idadagdag ko doon is we need to build value for the boosters. Kasi kung babalikan natin yung panahon, bago pa lang ang dating ng bakuna, di ba nga halos humihan ng magdamagan, talagang sasadyain mo. Kasi alam mo na maililigtas yung buhay mo pag nagpabakuna ka. Pero unfortunately for boosters, there doesn't seem to be that same value. So hindi lang yung information, kung hindi magpapahalaga dun sa bakuna pagtanggap ng boosters. Kasi I think that pagka nandoon na tayo, that we give it enough importance, then you will find a way to be vaccinated, to receive that booster. So bakit may disconnect? Bakit hindi dumudugtong yung information to action? Baka hindi lang information yung kailangan natin, no? Certainly maraming advocacies, yung napabanggit kanina, with respect to getting the medical professionals involved, I think it's a way of building them. Parang ipapakita mo na importante yan sa medical professionals. Kaya nga sila nag-aaksaya ng oras na pumunta doon at kumausap ng mga taong magpabakuna. So I think that's the missing link. Do people value the booster? Do they understand what that can do for them?
Okay, if you don't mind, no, kung pwedeng makihalo ako sa usapan na ito. Alam nyo, everybody knows me very well, no? I speak my mind out. I'm going to speak on an personal capacity, not as a Philippine College of Physicians person, okay? So I think ang key in any campaign will be effective communication. So probably I'd like to bring out the issue of the effectiveness of the campaign. The Pinas Lakas campaign, they have started, the government has started this few months back, and they were not able to get the desired outcome from this campaign. So I think it is high time, to go back and try to find out bakit ba hindi effective. Hindi ko na-achieve ang aking objective dito sa kampanya nito. And therefore, if you are not seeing the objective that you want to get from the campaign, then you have to revise the campaign. So it is not ringing a bell among the Filipinos. So change the campaign and change it to why Filipinos have to get booster doses. Yun kasi ang pinaka-importante. And try to debunk lahat ng mga arguments ng anti-vaxxers, because that's the only way we can make the Filipinos lined up and get themselves boosted. I'm sorry. I'm passionate because, we're not getting the results that we want to see. So I hope, sana nandito pa si Imran, Nasaan ba si Imran? Alright, so next, I think meron pang...
Sorry, one follow-up lang po.
Yes.
Okay. Dun lang sa communication, we know naman communication is really the key. Pero there have been like reports kasi, especially abroad, na parang yung booster, it's a double-edged word. Na parang it connotes something na hindi naman yan necessary kasi nag-booster lang, pang-boost. And yun naman yung Filipino culture na if it's not necessary, then they're not going to go for it. Right? So, meron po ba tayo, napapag-isipan na ba natin or any recommendation on how are we going to repackage this booster vaccination program?
Okay, with regards to the double-edged sword, I don't think that's correct. No? And we're here, Dr. Mario, immunologist. Would like to get the opinion of Mario here. Mario, you're here. Kindly explain to the press regarding the effect of boosting to our immune system. Mario Hayes is part of the vaccine expert panel and immunologist and also affiliated with RIAM.
Yes, good morning, Doc Gina. Hinahotseat mo ako. Anyways, so when you give a booster shot, it somehow wakes up your sleep. Kasi if our immune cells are not active, they're not going to be able to produce the antibodies and produce the T cells that's going to kill the virus when we get infected. So when they're just sleeping in that state of hibernation, it's not going to be effective in killing the virus when you get exposed. So the booster is actually a wake-up call, basically, because you already have them in your system. The main purpose of the primaries is to establish the memory. The main intent of our vaccination is a memory response. So that anytime na meron ka in the future, madali na siyang gumising. Pero for some reason, COVID is a very strong type of virus na unlike the other virus we know like measles or chickenpox, na it can take time for them to grow and to multiply in the body. Si COVID kasi medyo mabilis eh. So, unless talaga yung ating immune system ay alive, alert, awake, enthusiastic, hindi natin siya gagampan. So that's why the booster is really a wake-up call for our sleeping memory cells, as well as to activate them so that anytime, any moment that you get exposed, especially ngayon, medyo lumulog tayo, marami ng tao sa mall, marami ng tao sa sinihan and all that, na anytime na may expose tayo, hindi na natin kailangan na na antayin pa na dumami masyado yung ating immune cells, na na natin siya, nagising na natin siya. Okay ba yun, Doc Jean?
Thank you, Mario.
Thank you, Mario. So, okay na ba yun? Anyone else who wants to ask?
Hi, ma'am.
Yes.
Hello. Hi, ma'am. Good morning. Pasano po from ABS-CBN. I actually have the same question as Bots, but I'd also like to follow up since we have the Pinas Lakas campaign and now we're doing another special vaccination week, and I think Dr. Imran has laid out the plans for this special vaccination week. Ano pa po ba yung nakikita ninyong kulang dito? Kasi he talked about involving the LGUs, the medical societies, but wasn't this also done in the special vaccination days? So ano pa po yung pwedeng mag-iba and how can we do better in terms of encouraging people to get boosted this time around?
Ana?
Maybe, I think it's a very good question, no? Kasi kita naman natin kung ano na yung ginagawa and the components are maybe you would say similar to what's already online. I think yung advantage of dedicating vaccination days is really drawing attention to the target vaccine. Hindi yan naiiba dun sa mga tinatawag na supplemental immunization activities or SIAs na ginagawa natin kaparte ng ating national immunization program para sa mga bata. Di ba kasama naman talaga sa regular vaccination, for example, on measles or polio. And yan, nagpakontak pa rin tayo mga SIA o mga special supplemental immunization activities para lahat ng resources na pwede pa nating matap, lahat ng focus mailipat natin dun sa target na dumami para nabakunahan ng measles or polio. So, para ganun yung approach that is being taken with COVID vaccination. Ginawa din natin to nung simula, if you will recall, di ba, nung nagsimula tayo with the primary vaccination, that was actually quite effective. So we're hoping that by doing this with boosters, we will be able to get a large increase in the target that we want to cover.
I think the strategy that we are doing with this framework is the bandwagon strategy. In other words, you join everybody else. And what the DOH did was put a network within, sabay-sabay nating gawin, a blitz type. So you get off more attention, as what Anna was saying. But I guess also in the bottom line, as she has alluded to the National Immunization Program, we need to have more teeth in this aspect. So I guess one of the things that we can do, aside from this blitz program or bandwagon strategy of the DOH, is actually to require it in some aspects, like in workplace, maybe for children. So these are things that we can label off. Kasi like kami, as a hepatologist, we do require vaccination at birth for hepatitis B, no? So why can we not do that in this scenario? So I think putting more teeth is what the DOH can actually expand more.
Okay, thank you, Dr. Payawal. So you have one more, and then to be followed by the lady in white, Bayan.
Okay po. Moving to another pressing issue, ma'am, yung optional use of face mask na nirecommend ng IATF. What do you think about this, especially since we know that the experts have been firm naman in recommending that, you know, we continue to mask up even in outdoor spaces?
Okay. So I think most of us agree that it's not yet time to really put off masks outdoor, even with this trending down of cases. We see the importance of the protection with our face mask, and we need to think of other aspect of how we can improve. We should focus on boosting the population rather than thinking on a health protocol that, for me, has been very important. Why, even at this point in time, among other Asian countries, we are good with cases, because we're the only country that has been mandating masks for several years now, for several months now. Even with the cases going down, trends are going down. We focus on protecting the population, both outdoor and indoor. And for me, it will be the last policy that should be relaxed. Focus on booster vaccination and continue with the health protocol.
Yeah, and if I may add also, Jean, if you relax the requirement for the use of the face mask, then it basically gives also the impression to a lot of the Filipinos that there is really no need. You should not be afraid of the COVID-19 virus, or that there is not even vaccinate. So, paano na yan? So, paano mangyayari dun sa booster campaign natin? So, I think that will also weaken the entire campaign for the vaccination program. So, yes, before I go to you, let me just give the floor to our Secretary of the Philippine College of Physicians, Dr. Inal.
Thank you.
Yeah, thank you. No, I would just like to ask, what more are we missing with what we've been doing, especially the DOH activities? I'm DOH in the NCR. I see what NCR CHD has been doing. In fact, very
Yeah,
intensive every
very
day. In our Viber group, we see the pictures of where they go, where they do vaccination, sa tindahan, sa village, sa schools, sa malls. What naisip ko lang, are we maximizing the recipients as our emissaries, as our champions for the testimonies of why they got the vaccine? So gamitin natin, parang yun na tayo namimiss ko lang. Tayo yung nag-i-impose, tayo yung gumagawa. But are we mobilizing those who received the vaccine and make them testimonials, no, of what that vaccine is really needed? Siguro pag uwi nila, strengthen natin yung message to them. Ikalat nyo, i-gather nyo yung mga kasamahan nyo sa village, sa barangay, kapitbahay nyo, kamag-anak nyo, at sabihin nyo. So baka yun yung arm ng communication na hindi natin na-strengthen pa. No? Kasi in advocacy, I'm also with Dr. Lilipin, in advocacy, tobacco control, environmental control. And we really mobilize the partners, no, in the grassroots to relay the message. Yung nakikita kaya, no, na parang, oo nga, no, kasi sawang-sawa na kami sa pictures sa Viber group namin sa CHD, NCR, DOH. Talaga everyday, nando mga 10 areas, pero it stops there eh. Gamitin natin yung recipients. Gamitin natin sila to be our messengers. I-strengthen natin sila at i-support natin siguro. Baka yun yung missing link pa, no? Thank you.
I mean, baka din pwede yung mga celebrity friends natin, no, who can probably, join us in the campaign. Of course, wala naman tayo ibabayad dyan sa mga celebrities na yan. So at least if they can actually do it for, I think, our celebrities will be more than willing to do it for free. Because it's for everybody, no? Saving lives naman tong ginagawa natin. Anna, what do you think?
So it all connects with the concept of adding value to the booster. And I think we've gotten to the point where people have, we can't be 100% alert all the time, di ba? So dito na siguro pumapasok yung pagod eh. Admittedly, maraming nagkakaroon na ng vaccine fatigue. But once again, if we emphasize that this is going to be important to preserve our health, then it can be a reason, to continue seeking that particular intervention. So siguro kailangan pagdugtungin yung information na shinare kanina tungkol dun sa additional protection na maaasahan natin kung tayo nagpo-boost. Siguro kung ako ang kakausap sa pasyente, ang sasabihin ko sa kanya, alam nyo, maigi at nakapagpabakuna na kayo ng primary series ninyo. Kasi, by doing that, mahawaan ka man, hindi ka na matatakot na ma-hospital ka at madidisgrasya ka. Nandun na tayo lahat halos, lalo na dito sa NCR. Pero, nandito na rin tayo sa punto where we know that if we are boosted, that can be quite helpful in improving your quality of life. What does that mean? Bababa ang tsansa mong mahawaan ka. Kahit sinasabi natin na hindi naman primary objective ng pagbabakuna ay yung control of transmission, but yet, mas mababa ang tsansang mahawaan ka kung ikaw ay boosted. May impact ito, no, sa pang-araw-araw nating kilos. Ito ay makakatulong to be sure na nakakapasok tayo sa trabaho, nagagampanan natin yung ating functions bilang individuals in the family, nakakabawas dun sa risk ng pagkalat ng sakit within our households. So yung mga ganoong klaseng communication, new ones na siya, hindi necessarily discussion of mamamatay ba ako kung hindi ako magpa-booster. Hindi na kasi tayo ganun ngayon eh. Iba na ang hinahabol nating targets. Maybe those are the things that we need to surface para mas maintindihan din ng tao, kailangan ko nga palang makapagpa-booster. Kasi kung hindi, baka ako pa magdala ng sakit sa bahay namin. Baka naman hindi ako makapasok sa trabaho at mawalan ako ng sweldo for today. Malaking bagay, di ba?
Ada.
Yes.
I think at the end of the day, we need partners. And I think the media plays a specific role in this. Hindi lang po kaming doktor. So I challenge you as the media to do your share also. Do more information dissemination, more interviews, less interviews for those with hesitancy on vaccine. Let's do it together. So the medias are our partners. So that's why we invited the media here, because we'd like you to share this responsibility with us.
Can I now give the floor to the lady in white? Kanina ko pa siya in-acknowledge. Sorry.
Thank you, Dr. Yes, good morning. I'm Dr. Tanchoco from San Juan City. May we just ask, since opening of the daycare centers is already, I think, by next week, do you have any plans or any timeline for the vaccination of children less than 10 years old?
Ana?
The discussions are starting, no? There's, of course, the initial step is really to ask the manufacturers to submit their application to extend the EUA for those age groups, and they're being invited already to submit the dossiers so that it can be evaluated by the authorities and appropriate EUAs can be issued. So hopefully, no sooner than later, alam naman natin na that's the trend, no, globally. And hindi naman tayo nagpapahuli kasi nakikita rin naman natin yung value for the youngest population. If I can add, no, if you look at the data, makikita natin that the mortality rates are highest not just in the senior population but also in the youngest segment. So, hindi naman nagsisipagpasok yung mga ganong klaseng age group sa daycare. Pero tandaan natin na hindi lang natin napapag-usapan and yet the youngest population group are also significantly affected by COVID. At taas-taas ang mortality rate sa kanila.
So, I think one more. Okay.
Hello. Just a follow-up. I'm JC from EY. Just a follow-up on the recommendation on face masks by the IATF. To Dr. Anna and others may also give their inputs. Ma'am and sir, children are now going out and also back to school, and yet they have this recommendation on face masks. What are your thoughts on that?
Bilang pediatric population, no? If we go back to the discussions yesterday, first it was a policy recommendation with a verbal agreement. So we're still waiting for the actual document and what implementation, what will be the implementation, actual implementation. Pero kung tatandaan din natin, very nuanced na naman, no, yung sinasabi kasi, sige, optional sa outdoors, well-ventilated, non-crowded. So therefore, kung crowded, kung vulnerable, dapat ina-encourage pa rin magsuot ng mask. So, mga batang lumalabas, karaniwan naman, ang pinupuntahan lang talaga nila school, and of course, on the weekends, malls. Ang malls, closed, crowded, therefore mask. Ang school, crowded, closed mostly, nasa school, therefore mask ka pa rin. So actually parang wala siyang masyadong difference for the school-going population. The rules will hold. Siguro, opportunity lang ito para sa mga bata will be, pag lalakad sila galing sa bahay hanggang sakayan, hindi sila nakamask, okay lang. Pero kung ikaw bilang magulang ka, sabihin mo, sandali lang naman yun, isuot mo na, baka malapag mo pa sa kung saan yung mask mo tapos hindi mo na mahanap, di ba? So operationally, malamang ang mangyayari, kids will still continue to be wearing their masks wherever it is that they congregate because they have very limited spaces kung saan sila pinapayagan sa ngayon.
Yes.
Yes. My name is Rory Visco from Business Mirror. Given all the attestations about the safety of the vaccines, do we see in the future vaccine manufacturers applying for a CPR with the FDA? And do you think that this would add a little bit of perception of safety for those who still doubt the safety and effectivity and efficacy of vaccines? Thank you.
Okay, can I answer? I think the direction now, most of these vaccines now, since we have been having this EA for the past almost 2 years now, they're already preparing for a CPR. And part of evaluating when you will be submitting a CPR is always the safety. So in a way, if Philippine FDA will approve it, then that already goes that this vaccine has been proven to be safe and aside from being effective. So on that note, I think it's also an important way of moving forward because we have what, in terms of the freedom for people to get it, okay, although at the expense of buying it, there are populations like the business sector, that can have that leeway of providing more protection in the workplace, and we're looking forward to that most of these vaccines will apply for a CPR. Of course, the downside there is that it's not anymore free, and we miss that opportunity that people should be getting it when they are free. But that's really the course of process of the vaccines.
It's not only peculiar with vaccines. It stands with a lot of all the new drugs. So hindi lang po sa vaccines yan, yan mga bagong gamot na available for us, whether it's for hypertension or diabetes, you need to undergo the same process.
Okay, so are there any other more questions? Yes, the one in black.
Hello. Hello po. Good afternoon. I'm John Garner from Daily Tribune. I have two connected questions po. Number one is, what do you think is the basis of the IATF recommendation for the optional wearing of face masks in outdoor spaces? And number two, we all know that the DOH has been consistent in opposing the Cebu City government on its executive order on their optional wearing of face masks in outdoor spaces din po. What do you think is the message being sent to the public by the sudden change in protocols po? Thank you.
So, who's going to answer that? Ayaw nila hot water daw.
Sir,
baka anyone who knows about
I don't know what
the
the IATF procedure is, but just to sound off from our partners in Cebu, if you listen closely to the concern, it's actually economic. They were saying that this is one way of decreasing the economic burden. But what is the economic burden of wearing a mask? The concern is the objective of the strategy of our partners in Cebu does not correlate with the strategy that we want to do with the mask. Will you be limited to your economic burden when you wear a mask? I throw that question to the one who is asking question. Sir, do you think your economic strategy to get a job will be decreased in your mask? So I think everybody knows that everybody is out. You can see the traffic being heavy. You used to come back to work 30 minutes before the time, but now you have to leave 1 hour or 2 hours before a schedule. So I think we're almost back to work. So I don't think the economy is burdened with wearing a mask, because that's the contentious issue our partners in Cebu are saying.
So again, no, for us, our position is the last, face mask is really the last one to go. No, if we're going to relax in any policy, it should be the last one to go. So, last two questions. Kahit po sino sa inyo sumagot. Yeah, can you please? Yeah.
Do you think there is a need to bring back policies such as vax, no ride, no vax, and entering of malls? Because this helped in the past increase primary vaccination. Baka makatulong po ito para pataasin ang boosted population.
Yeah. Okay, maybe Dr. Nante can answer that.
Yeah, I think that was also emphasized by Dr. Payawal kanina. No? Na we have to put this in terms of increasing our vaccination coverage in booster. We have seen that the primary vaccine series, that since we now know that the primary vaccine series is not working anymore, okay, you need a booster vaccine to restore that waning effectiveness. It's for me a high time that we need to require booster or updated vaccine as a requirement when you go to the mall, when you go to your work, or when you go to parks or any other high-risk area. And I think that for me, we should focus on that rather than, again, tinkering on the health protocol.
Yeah. Thank you, Jean. Okay. Tama yun, no? Again, matagal nang stand yan ng PCP, no? Na i-require yung updated, no? Sa pagtingin ng updated vaccine. So it's not just about the primary vaccine, but also the booster doses, no? That one should get. So last question coming from that table.
Good afternoon po everyone. I'm Dr. Lat from Antipolo City Health Office. Question po, balikan ko lang po yung naunang question. Bilang po yung mga nasa ground, nasa field, nasa vaccination sites, may time frame na po ba for the second booster ng the rest of the population, especially po the A4? Kasi yung nasa ground po, bilang kami po ay masunuring sundalo ng Department of Health, sinusunod po namin ng mga advisory na binibigay po ng DOH. Kung sino lang po yung bibigyan, kung sino po yung mga eligible, yun lang po ang hinahanap namin. Pero meron po tayong mga kababayan na nagpupibigit din po, mabigyan po. So, ang kadalasan po sa field, sa mga vaccination site, nangaaway din po sila. Ang sasabihin po, aantayin niyo po bang magkasakit pa kami bago niyo pa po pabigyan? So, na-explain po namin, nakita po namin yung guidelines and yet, hindi pa rin po maunawaan. Yung mga vaccination medical team po, naunawaan po namin kung ano po yung advisory ng DOH. Pero yung mga kababayan po natin na hindi po nakakaintindi, and yet, po sila nagpapabakuna. At meron naman po tayong sapat na bakuna. So, sana po, dumating din po yung pagkakataon na sila po ay mabigyan din po. Speaking po ito ng mga nasa LGU, hindi lang po sa Antipolo. Kasi meron din po kami GC. Nakita po yung mga concern ng aming po mga kapwa po nasa public health po. Salamat po.
Yes, so actually, that's a common situation na na-encounter natin, na nagpupunta for the second booster, no? So, any thoughts on that?
Thank you, Dr. Lat, for sharing that experience. I think ito naman yung flip side yung problema natin. Merong mga kailangan magpa-booster, ayaw magpa-booster. Yung iba naman, hindi pa nasa tamang panahon. Sila naman yung ganadong-ganado ng magpa-boost. I can really understand yung struggle ng frontliners. Kasi syempre, nandun na, makikipag-away pa sa'yo, may bakuna ka naman, ba't di mo na ibigay? Diba? Yun naman, parang hindi naman yun mali. I guess, ang ano lang natin, ang ating pinangahawakan is any medicine or any intervention, kung hindi naman aayon dun sa taong humihingi, ba't naman natin ibibigay? So, ito naman yung nasa ganang atin bilang healthcare professionals. For the patients, siguro if it were any other medication, no? Kasi nasa private clinic kumukonsulta, nagpumilit si pasyente na ito ang kanyang gamot na gusto. Tayo naman bilang healthcare professional sasabihin natin, ay hindi po yan bagay sa inyo. No? Saan po tayo magtatapos doon? May mga instances na tayo ang nasusunod, naliliwanagan ng pasyente, hindi na tayo napipilit doon nagtatapos. Pero may mga pagkakataon na dahil sa pagpupumilit nila, natutuloy yung intervention. But we ask them to sign waivers or indicate in a document na naiintindihan ko po na ako po ang nagpumilit, etc., etc., etc. I think that's the only way to approach it, no? Para naiintindihan siguro nung nag-i-insist yung halaga nung hinihingi niya or yung consequences rather nung hinihingi niya. And I'll really be one to resolve the issue.
May follow-up ka pa, Doktora? Okay. Okay. So with that, we end the Q&A part of the session. So thank you for actively participating. Again, for anyone who wish to have a one-on-one interview with any of our speakers, be it foreign or local, so kindly get in touch with our PCP staff or with Tina. We are now about to have our lunch. So if we can first have photo documentation, photo op, no? First photo op will be with our speakers, and then later on we would like to invite some of our invited VIPs. Tayo muna daw.
May we please request everyone, please, everyone in the room, media friends, LGU, medical societies, thank you very much. Okay, 1, 2. Thank you very much. And now for the closing remarks, we have Dr. Imelda Mateo.
I know everybody wants to have their lunch, so in behalf of the Philippine College of Physicians, I would like to thank all the speakers, Dr. Ong Lim, Dr. Mungal, Dr. Lee, Professor Carissa Atlas, and Dr. Imran Rodriguez of the Department of Health, together with our PCP board members, Dr. Salante, Dr. Limpin, and Dr. Payawan. Today was an extensive discussion around the comparable efficacy and safety of viral vector and mRNA vaccines, especially in this Omicron era, as we transition into an endemic phase of living with COVID-19. This gives us confidence to pursue third, fourth, and next dose booster vaccination rates using the existing vaccines or first-generation vaccines for both the most vulnerable and for every Filipino. It is crucial to continue our emphasis on the science and the evidence as we continue our multi-stakeholder collaboration in the execution of our COVID-19 vaccination program. The Philippine College of Physicians has been and continues to be committed to our government and our country as we look to work together to protect our fellow Filipinos against COVID-19. Look forward to probing more evidence, help in building more health strategies, and more vaccination initiatives in this noble fight for our people. And we will do it together. Thank you very much.
So thank you very much, Dr. Mateo, and congratulations to all our speakers for accomplishing your mission for today's meeting, fighting the health misinformation with science and education. So, friends, this is again Dr. Maricar Limpin. It has been a pleasure to share this morning with all of you. Thank you very much. Let's have a good lunch.
Recording stopped.